Rich plasma methods on hair transplant surgery.
Good morning. Pleasure to be here. I will present today comparing the effects of two different platelet-rich plasma methods on hair restoration surgery. Both of those are autologous platelet-rich plasma. As hair restoration surgeons, our primary interest lies in shortening the wound healing period, especially in the recipient area. Our colleagues, Dr. Bernstein and Dr. Russell, also underlined the importance of shortening the healing time in their manuscript, dated 2006. Today, we still agree that accelerated graft formation, which we think is a sign of rapid revascularization, is not only essential for patient comfort, but also for hair regrowth. The most important player in the early healing phase of hair transplant surgery is the crust. In the beginning, the crust acts as a fixator that keeps the transplanted follicle in its new bag. However, not long thereafter, it becomes a hindrance to the new root with its weight on it. Extra effort spent on dissolving the crust is next burden on the follicle. My personal clinical observation shows that a longer crust formation period usually results in a less successful hair regraft. There are various possible protocols to shorten the healing period by accelerating the shedding of crusts. Some of these are irrigation, ointments, occlusive dressings, and lately PRP. Interest in PRP grew thanks to Super Bowl. Before the game in 2009, Heinz Ward and Drew Palomalo got their knee injuries treated with PRP. New York Times wrote an article on it, and PRP's popularity flew off the charts.
To your right. Double click on it.
Now, okay. To understand the idea behind PRP, we need to remember platelet physiology. As major players in the hemostasis, platelets are also a natural source of graft factors essential for tissue regeneration and healing cascades. As major, and how they are acting actually. Platelets adhere to the vascular injury, secrete their granule contents, and finally form a mechanical plaque. And to use the body's own healing cell in a more concentrated way brought clinicians to the idea to simply sequester them and enrich the plasma as an active healing agent. There are various preparation systems of PRP. Numerous methods and kits give different platelet concentrations with different additions in them, such as white blood cells. Ideal concentration and ingredients are yet to be defined for different medical fields. When preparing the PRP, platelets need to be activated too. Following the activation, platelets will release their growth factors. Here are some growth factors. Here, and by increasing the number of platelets, it seems to be possible to increase the amount of growth factors and especially their mitogenic effect. As a frequently used treatment in orthopedic and dental surgery, PRP shifts the remodeling phase in wound healing couple of days. Our study had two goals. We wanted to investigate the effects of PRP on the hair transplantation. We mainly looked at three variables: duration of wound healing, survival rate of hair follicles, hair regrowth time. These parameters we had the chance to evaluate with two different PRP concepts. We knew that the commercial kits had various different advantages compared to the simply biochemical prepared version. So to summarize, we wanted to see if PRP had any effect on hair transplantation, and if so, if there was any difference between two different preparation methods. We had 60 patients in our study. We divided them into three groups. This was a randomized but not double-blinded study. First group consisted of routine hair transplantation patients without any post-operative additional therapy. The second group got a PRP-A treatment after the standard hair transplantation. We prepared PRP-A according to the method described by Lacoste et al. Final platelet count with method A was between 700,000 till 780,000 per microliter. Third group consisted of patients who were treated with PRP-B. B is prepared using a commercial kit system. Average platelet concentration was more than 1 million per microliter. Unlike PRP-A, B contains white blood cells. We injected the Apollo PRP post-operatively into the surgical area. We used dermal needles with 2 uniform gauge. Each patient was photographed on the 1st, 3rd, 5th, and 7th days to document the wound healing process by day. In addition, we gave a survey to patients and collected their subjective answers to our variables. This is the self-assessment questionnaire. 10 questions to evaluate duration of crust formation, redness, swelling, wound healing, and hair regrowth time. And here are statistical results of our evaluation. In both PRP group, crusts have been shed out in average 1 day earlier compared to the control. Redness after crust shedding was similar in all groups, but slightly more in control. Swelling was slightly more in PRP groups. A significant change was in both PRP groups for crust shedding, and hair regrowth time with the shortest in PRP-B and longest in control group. Here are some pictures from control group at day 5. This is patient 17, another patient, and next patient. These are all control groups. Now PRP-A, again day 5, another patient, and we can easily see the difference between PRP with or without PRP crusts. Difference between two groups is in the color of crusts. They are lighter, smaller, and thinner. And this is another PRP-A, day 5, a vertex area. The last PRP-A, day 5, I collect all the pictures so in a row to see the difference. This is PRP-B with the kit, day 5. They are much more thinner, the crusts. This is another PRP-B, day 5. It's a big session with almost 4,000 grafts. This is PRP-B, day 5 again. Results. Now our results. Postoperative telegenic effluvium occurred in each group, and with negligible time differences between groups, no big difference. Hair regrowth time after surgery was observed to be approximately the same in each group too. Exudative phase is slightly longer in both PRP groups. There was slightly increased edema in both PRP groups. Thickness of the crust are significantly decreased at both of the PRP injected groups. Crust fell off quicker in the PRP-B group as opposed to the PRP-A group. And conclusion is, thinner crust exercise less pressure on the newly transplanted follicle. This may have a positive effect on the hair regeneration process. We think that a PRP treatment could be used in hair transplantation post-operative protocols, and ultimate conclusion is that more investigation is necessary for further define. Thank you very much.
Continuing on the PRP topic, Dr. Robert Reese from Minnesota is going to talk about autologous platelet-rich plasma, developing an industry standard for hair